back to First Coast Living. I made it out here to UF Health Proton Therapy Institute, and I'm joined by Dr. Henderson. I appreciate your time, sir.
Thank you. It's good to be with you.
I know you're extremely busy here. For those who have not, you've been around for 12 years at the Institute here. For those who haven't been here or know about proton therapy, talk to me about the benefits of it.
Proton therapy is a newer form of radiation to treat cancer. The form that most people are familiar with would be described as X-ray treatment, very widely available across the country. But we use protons, which are heavy charged particles, to treat cancer. And there's an advantage to using protons. When you use X-rays to target a cancer, each of those X-ray beams that are directed towards the cancer go all the way through the body, just like a chest X-ray would go through the body, the X-rays. But protons have a unique property in that they actually damage the tissues less along the entry path of the protons. They get to a certain depth, give off all their energy, and stop. And contrasting that to the X-rays, where the tissues along the entire beam path through the body are affected by that treatment.
And talk about what that causes, though. Hitting everything, that's worse for the patient, correct?
It is, because the energy that's deposited has an effect on normal tissues and cancer cells. So you'd like to minimize the amount of radiation effect on the normal tissues. That reduces side effects and also reduces the possibility of a problem down the road in years to come.
And the cancer we're specifically talking about today is prostate cancer, and which is obvious reasons why being more precise in that area of the body is important.
Absolutely. There are sensitive structures in that area. The bladder and the rectum are right next to the prostate. So if we can focus that radiation so that it is deposited in the prostate, and with protons we can stay off the bladder and rectum better, then that reduces side effects and reduces the risk of complication down the road. And
one of the things that 12 years in, you now have 12 years of data collected on all the treatments, but you continue to be here at the UF Health Proton Institute. You continue to be on the forefront of the research. And I was told you guys just got awarded a new grant from the government to do more research.
We did. We're very excited. Dr. Nancy Mendenhall, our medical director, is the principal investigator who designed the study. And we were awarded $11.9 million to do a nationwide study that will compare proton therapy to IMRT X-ray treatment in terms of their effectiveness and the long-term side effects and risk involved. There'll be 24 proton centers participating across the country and 20 X-ray centers that'll be enrolling 3,000 patients on this study.
It's interesting to hear you say 24 proton therapy institutes across the country, because I remember when this opened, and it was, I don't want to misspeak, it was the first or one of the first couple in the country.
It was one of the first. It was the fifth one to open.
Okay.
Yeah.
And so that, being there and that research, how long is that going to take, and what do you think, what are you hoping to get out of that research?
Well, it will give us a more robust answer to the question as to how much better protons are than IMRT and how they compare between the treatments. What we have had so far is the opportunity to treat patients here and then follow them over time and see what the results are with proton therapy, and we've been very encouraged by that. We normally think of prostate cancer in terms of low risk, intermediate, and high risk groups. And if we look at our outcomes with low-risk prostate cancer, the chance that there's no sign of cancer 5 years down the road is 99%.
Wow.
And for the intermediate risk group, it's 94%. And for the high-risk group, it's 76%. So very encouraged by those outcomes, especially when you consider the fact that the rate of having problems down the road with the complications to normal tissue has been very, very low. So our outcomes have been very encouraging, and we're looking forward to the opportunity to be able to compare our outcomes with protons to a comparable group of patients with IMRT.
Well, we're out of time. I love talking to you guys here. I always learn so much. One of the things that I want to encourage people, if you know somebody dealing with prostate cancer or any type of cancer, second opinion is always good, right?
Absolutely, and they can just give a call to us at area code 904-588-1800, ask to speak with patient intake, and they can get information to you overnight.
We appreciate the UF Health Proton Therapy Institute for having us out here and sharing their services and always teaching us something.